My name is Tel Ganeshan, president of TIE Detroit. I'm here with Nancy Schlichting, one of the most inspiring, dynamic healthcare leader in the whole country. Hi, Nancy.
Thank you. I appreciate that wonderful introduction.
Nice to meet you. Yeah,
nice
thank you for coming.
You.
Yeah, meeting with us. So, what's the future of healthcare mobility look like?
Well, healthcare is going through the most dramatic change that we've seen in 50 years. And healthcare mobility, really allowing us to deliver care in new and different ways, I think is absolutely our future. Okay. So it's an exciting time.
Okay, that's good. So obviously, healthcare, innovation is happening at Henry Ford. So what are some of the insights from you on the new line of thinking at the Henry Ford Innovation Lab without revealing some of your secrets?
Well, we set up the Henry Ford Innovation Institute a few years ago, really to capture the creativity and bring it to commercial success. Historically, we've had tremendous innovation going on at Henry Ford, but we didn't take it to the market. So this Innovation Institute has allowed us to do that. Okay. And one of the really cool things we've come up with, and it was through a partnership with the College for Creative Studies here in Detroit, is a new patient gown. Okay. The Model G, which we think is great for Henry Ford.
Obviously, as you know, the healthcare cost is going through the roof. How do you envision the new healthcare mobility models, and with the technology rapidly changing, is going to address that in your view?
Well, the challenge for all of us, particularly as our population is aging, is how to deliver care more efficiently and effectively. Okay. And healthcare mobility, digital health, really allows us to connect with our patients in new and different ways and avoid some of the inefficiencies and costs that are built into the current model.
Okay. So as you know, we have a lot of new age entrepreneurs with the millennials, so they're all into all kinds of disruptions. And as you know, that there are so many startups that are popping up everywhere. How do you see the big healthcare companies working with those startups, and how can we encourage those entrepreneurship?
Well, I think the entrepreneurship time in our healthcare life is fantastic, and we need disruption. The old model is not working. It's not delivering value at the level that it needs to. Sure. So I am a big encourager of disruption. Okay. And I think not all health systems engage disruptors as well, but you have to be persistent. Okay. And you have to find connection points within large healthcare systems to bring your ideas forward.
Yeah. And I was reading your book on leadership, and you're so passionate about Detroit, and you're so passionate about Michigan. I think you talk more about that than the governor. So the question to you is that, what is your view on Michigan as it relates to innovation, as it relates to entrepreneurship?
Well, I'm an outsider. I wasn't born here. I didn't grow up here. So when I moved to Michigan, I saw all of the possibilities. Okay. And this is a state that has been known for innovation for, its history. But now we have to do two things. One is we have to recapture that spirit of entrepreneurship, and we also have to diversify. Okay. It's not just about automotive, although that's very important. Sure. But it also is about healthcare and new technologies that can really transform our economy.
What do you see the events like TICON helping the region, and why is it important to entrepreneurs in the region?
Well, first of all, I'm honored to be a part of TICON. Okay. Because I think it's an event that will really engage us, energize us about the possibilities, and really allow all of the entrepreneurs out there to learn new skills and ways that they can connect and bring their ideas forward so that they come to fruition.
Thanks, Nancy. Thanks for accepting the keynote, and look forward to seeing you at the conference.
Well, thank you. It's a pleasure.